was in a hospital, I met quite a few foreigner doctors. They come in, attached for 2 months, 3 months, to learn basic heart bypass operation. So those are called fellowship program, whereby the country that sends them or the hospital that sends them continue to pay their salaries, but we provide some local support, hospitality, so there's co-funding. But key point is they come here to learn something. So it's specific. This is what I lack. I want to learn this. So it struck me that we can apply this to MOH officials who are in planning, be it designing health insurance, be it designing, in our case, for example, how to restructure hospitals, which is of great interest to China. Because one of the major reforms in China is how to turn their 100% owned public hospitals, which is far from being hassle-free, not to privatize it, but how to run it with private disciplines and involving the skills, sets and expertise of the private sector. So they are extremely interested in this aspect of the way we organize things. And likewise, I have interest in other areas. For example, the long-term insurance scheme in Japan is of great interest to me, particularly the pitfalls. So in fact, I've tried out before. And between, for example, Macau, over the last 2-3 years, Macau sent, we don't call it fellows, but health officials who come to attend for 2 months, 3 months, and actually attach to our MOH headquarters. And along the way, you really, because briefing half an hour, you don't learn much, other than you have a vague idea what it's all about. But actually working with my staff and tackling real problems. And that's the approach we did in the Suzhou Industrial Park many years ago. So I'm just applying that. And Macau find it extremely useful. And I myself, for example, we attached fellows to Hong Kong. So when we were starting to do pneumococcal vaccination, because they were ahead of us, so I attached one of my staff to Hong Kong to see how they implement it. And it was extremely useful because their initial implementation get into a lot of trouble. And we were therefore able to learn from that and avoid those troubles. So when we did it in Singapore, it was quite smooth going. So I suggested it. I said, why don't we sort of brand it in ASEAN plus 3 fellowships, and it can be completely flexible. What do you want, and so on. To 1 month, 2 months, 3 months, and the co-payment scheme can be very flexible. So I can send to you, you send to me, and it was very well received, and we intend to push to those ideas. And again, the bottom line is my interest is when they come for attachment, they get to know us, and we get to know them. And again, this is another very useful network that we can pick up the phone anytime. Yeah. So overall, I think it was, from my point of view, a good meeting. We had a good discussions, and I think so. This morning is the last event. Some of them are very interested in our new hospital, although many of them are leaving today, so they can't attend. But we will see some of them. Yeah.
Would you say that bonding between ministers and officials is the biggest takeaway from the meeting?
Absolutely. I think that was my priority too, because to try to create opportunities for such bonding so that we can literally just pick up the phone. Yeah. Because when something happens, by the time you read about it, it's at least a few weeks, if not months, late. But nothing like picking up the phone. And verbally, they find it easier to be more candid. Yeah, I really have this cluster of patients, very strange. They are displaying something, and so that alert is helpful to us. Yeah.